Hello, everyone. Really good to see all of you virtually, and a very warm welcome to this virtual event in which we are uniting for adolescents during COVID-19 and beyond. My name is Mercy Juma, a correspondent for BBC News based in Nairobi, Kenya, and I am so pleased to moderate this very important discussion coming ahead of the 10th Economic and Social Council Youth Forum. Now, thank you all so much. I can see some people still in the waiting room and they are coming in. Thank you all very much for creating time to be part of these discussions. Now, for the next 1 hour and 45 minutes, we are going to have a very candid conversation on adolescents with adolescents. And today we are here to just meaningfully listen to them and to reiterate the messages in the calls to action on COVID-19 and on adolescent well-being, asking that young people be placed at the front and at the center of our decision-making during this pandemic and beyond. We are here to make meaningful noise about the challenges young people are facing, which are very well articulated in the BMJ article. So if there are things that I would really advise you to go and check out so that you can make meaningful and proper notes: the call to action on COVID-19, the call to action on adolescent well-being, and the BMJ article, just to see what the adolescents want and how meaningfully can we put into action what they desire. Now, a huge thank you to the co-hosts, Costa Rica and Philippines, and all the co-organizers for this event. Thank you so much. And this is going to be a highly interactive event split into 3 sessions. At the very beginning, and just a few minutes from now and towards the end, we'll hear from key speakers, and in between we'll have breakout sessions led by young people across the globe in conversation with ministers discussing issues around the holistic approach to adolescent well-being. Now, please feel free to air your thoughts on chat. If you have any questions, please do post them on chat. And time allowing, we will ask our panelists to address them. We'd also love to hear from you on the socials. The hashtag we are going with is hashtag Adolescents2030. So please keep the conversation going. Let's make noise about adolescents, about their well-being, about their health, and the holistic approach that we need to address the issues they're talking about. And now, ladies, to kickstart this conversation is our first panel, in which we'll have a mix of recorded and live speakers. And our first 5 panelists are Honorable Helen Clark, PMNCH Board Chair and former Prime Minister of New Zealand. We have His Excellency Alejandra Acuna Navarro, who's the Vice Minister of Health, Costa Rica, and Jayatma Wikramanayake, UN Youth Envoy. Sarah Cognac Gonzalez, a teenager from Costa Rica. Really glad to see you, Sarah, online. And Maziko Matemvo, Adolescent Youth Constituency Vice Chair, PMNCH. And I will start with you, His Excellency Honorable Navarro. But just before I do, here is a video message from Helen Clark.
As Board Chair of the Partnership for Maternal, Newborn and Child Health, I'm so pleased to be able to speak to you at today's crucial event. PMNCH has been working with many of you on its call to action for adolescent well-being, launched in 2018. The call emphasises the importance not only of prioritising adolescent health and well-being, but also of meaningful engagement with and support for the empowerment of young people. Those 2 themes, engagement and empowerment, are central to today's session. Adolescence, we know, is a vital stage in life's journey, but it also can be a challenging one, making it all the more important to work with young people. The aim being to support every adolescent to reach their full potential. The benefits of that for individuals, communities, and societies at large are so great. The COVID-19 pandemic has exacerbated the challenges which the world's 1.2 billion adolescents face. Among those challenges are inadequate social protection, worse employment prospects, challenges of loneliness and to mental health and well-being, and the increasing prospect for many of living on the streets or dropping out of school. While adolescents everywhere are impacted to some degree by the pandemic, those who were already the most vulnerable, not least in the fragile and humanitarian settings, are affected the most. PMNCH's call to action on COVID-19 has been a rallying cry for action for the ongoing and critical services which our constituencies, women, children, adolescents, need at all times. More than $20 billion has been committed in line with our call by countries and philanthropy. Today, we call on all present to support this vital health financing effort and to consider what commitments your governments can make to protect adolescents during and after the pandemic. PMNCH's message is clear. If we collectively are to respond better to the ongoing pandemic and build a truly inclusive, resilient, and sustainable recovery, our world just has to respond far better to the needs of adolescents. And we must involve them in the design of the policies and the programs they need. That's why last year, PMNCH asked its community to share perspectives on the challenges adolescents face and on the progress made so far in addressing them. We also asked for opinions on what meaningful engagement could really look like. We will soon be publishing these views, and we will continue to provide platforms for young voices to be heard. Our approach to adolescent engagement is set out in our Adolescent Wellbeing framework. That's a key part of the call to action for adolescent well-being, and it's a central pillar of our new PMNCH strategy for 2021 to 2025. Today, we'll look at the framework's 5 domains and the main areas of adolescent well-being, and we ask how ministers can work with young people to build successful futures. I cannot stress enough how vital your input is. We want to take your ideas forward to the UN sessions in July, when countries report on progress towards the Sustainable Development Goals. Your ideas today can become tomorrow's commitments, leading to concrete actions as we approach the Global Summit for Adolescents in 2023. If we are to recover well and rebuild from the COVID pandemic, your voices must be heard. Let's make today a launch pad for lasting change. Thank you so much.
Thank you very much, Helen. That was Helen Clark, Board Director of PMNCH, a former Prime Minister of New Zealand. And thank you so much. You at PMNCH are really doing a great job advancing and advocating for advancement of the health and well-being of adolescents. And now I will come to you, Ms. Navarro, Alejandra Navarro. Helen talks about really important points on protecting adolescents' progress and investing in them if we are to build back better. Why should we invest in adolescents? Why is this important?
Bueno, muy buenos días. Saludos a los organizadores, a la Asociación de Salud Materna y Recién Nacido del Niño, en este gran evento Unión para los Adolescentes durante el COVID y más allá. Desde mi perspectiva, la inversión en la salud de los adolescentes no es una necesidad y no es una urgencia. Esta población representa cerca del 21% de la población, según datos de la OPS. Es una etapa preparatoria para la vida productiva, y si lo queremos visualizar desde un enfoque socioeconómico para la vida productiva, sí, específicamente un enfoque socioeconómico, es importante invertir en ellos. Pero si lo vemos, digamos, desde un enfoque de derechos humanos, esto permite a los Estados miembros escuchar sus necesidades, buscar soluciones de forma conjunta. Se genera la autodeterminación y la capacidad de participación activa de la generación de la política pública dirigida a alcanzar los objetivos de desarrollo sostenible. En Costa Rica tenemos, por ejemplo, la experiencia en la generación del Plan Estratégico Nacional de Salud de las Personas Adolescentes 2019-2030, donde desde un enfoque de determinantes sociales se atienden las necesidades de forma articulada intersectorial, donde las voces de los y las adolescentes ha sido un éxito. Por eso debemos de invertir en ellos. El COVID ha afectado de manera sustancial a la población en varios aspectos. Según los datos nuestros en el Ministerio de Salud, la población menor de edad representa cerca del 8% de los casos detectados. Y acorde a una investigación social que se realizó en ciertas áreas, se detectó que la mayor cantidad de casos de la población se da en zonas con bajo índice de desarrollo social, zonas de hacinamiento, pobreza, donde la necesidad cultural y de socialización y de las relaciones de cooperación los condujo a tener lo que llamamos nosotros burbujas sociales ampliadas. O sea, ellos salieron de sus burbujas y por lo tanto hubo un mayor desarrollo de la pandemia. Para el abordaje de la atención de la pandemia en Costa Rica, se cuenta con una estructura gubernamental desde el más alto nivel. Se generaron 10 mesas de trabajo. Menciono 3 vinculadas a la atención del adolescente: la de salud, la mesa de protección social y la mesa de educación. Se desarrollaron acciones articuladas e intersectoriales entre las diferentes mesas. Además, Costa Rica cuenta con un Consejo Nacional de Niñez y Adolescencia, el Consejo de la Persona Joven, entidades conformadas por representantes gubernamentales y de sociedad civil que se dieron a la tarea de escuchar los intereses, expectativas y preocupaciones de los adolescentes y jóvenes. Es así, según esos diagnósticos realizados por varias entidades, que se da una mayor afectación en algunas áreas, principalmente la pérdida de continuidad en la prestación de servicios de salud, como lo que es la atención de salud sexual y salud reproductiva, la salud mental, dada por el confinamiento, la interrupción del ciclo lectivo y el cierre de espacios públicos, entre otros. Es a partir de ello, de la mesa de salud, con el acompañamiento de las diferentes instituciones, se elaboraron una serie de lineamientos que permitían atender a las personas adolescentes bajo una red integrada de servicios y también para establecer puntos de partida para el abordaje preventivo y de atención de salud mental y el apoyo psicosocial comunitario. Costa Rica cuenta con un sistema de emergencias robusto, el 911, que se fortaleció durante la pandemia y permitió la articulación con diferentes instituciones del país. Es de acceso universal, sin costo, desde cualquier teléfono. Desde ahí se generaron acciones o se siguen generando acciones del despacho de apoyo psicológico con un convenio con el Colegio de Psicólogos. También la línea Aquí Estoy, alianza específica para ampliar los beneficios a nuestro país en la línea basada en el convenio de cooperación entre el Ministerio de Educación y el Colegio de Psicólogos, el Patronato Nacional de la Infancia, el despacho del Instituto Nacional de las Mujeres. En materia de salud sexual reproductiva, creo que este fue un tema que sí tuvimos una interrupción de un modelo de prevención de embarazo en adolescentes que tenemos nosotros de manera intersectorial. Se mantuvieron algunas de las acciones previstas como compromiso del Plan Nacional de Desarrollo. Sin embargo, es de destacar que tenemos grandes desafíos y grandes retos para continuar con este proceso a nivel del país. Desde el Ministerio de Educación Pública se generó un plan integral del abordaje del servicio educativo ante el COVID-22. Con el apoyo del Ministerio de Salud se generaron protocolos para un regreso seguro y paulatino a la presencialidad que ya inició este año. Para terminar, el gobierno apostó a un desarrollo de un modelo de gestión compartida que se llama Costa Rica Trabaja y se Cuida. Ese modelo, a partir de análisis de datos epidemiológicos y valoración de riesgo cantonal, se genera un plan cantonal de prevención y atención del COVID. Es un proceso continuo de evaluación y ajustes constantes. Nos deja una gran lección este proceso, que para atender este tipo de pandemias y especialmente a grupos vulnerables, en este caso el grupo de adolescentes, solo se logra mediante la conducción y articulación desde el más alto nivel político, con un abordaje intersectorial, con espacios de comunicación y participación social. Muchísimas gracias.
Thank you very much. Really good to hear what you are doing in Costa Rica and all the effort that you put in to ensure that we build back better from COVID-19 and that we cushion adolescents in your country. Now, I have a super adolescent, super teenager who's on the virtual screen from your country and who will come up shortly. But before we go to her, let's see this video done by Jayathma Wikramanayake, who's the UN Youth Envoy.
Hello everyone, I'd like to start by thanking all the partners for organizing this important event ahead of the 10th anniversary of the ECOSOC Youth Forum this year. It's excellent to be joining all of you today virtually for this convening. I want to also recognize the important contribution of all of the governments involved here in the call to action for adolescents, and in particular to thank the governments of Costa Rica and the Philippines for co-sponsoring this very important event. With that being said, it is the young people themselves who are at the forefront of today's event that I want to focus on. A major priority for me as the Secretary General's Envoy on Youth is promoting youth empowerment and the meaningful engagement of young people across all pillars of the UN's work. This is central to the adolescent agenda. As the call to action sets out, young people and adolescents themselves must be engaged in all legal, policy, and programmatic decisions that affect them. Youth engagement is not an optional or an extra. It is absolutely fundamental to achieving the SDGs and indeed to building back better from COVID-19. We can't possibly have effective programs for young people if we don't actively involve them and engage them. Adolescents are often among the most left behind, and if we are to achieve positive SDG outcomes for young people from now through to early adulthood and then later into the life, action for and with the 10 to 19 age group is extremely critical. The UN's first ever system-wide youth strategy, Youth 2030, emphasizes that alongside youth engagement, we must also focus on priority areas such as access to quality education, health services, and addressing the social determinants of well-being. Setting the conditions for young people to reach their full potential is critical. We must begin with adolescents if we are to kickstart the action we need. COVID-19 has disproportionately affected young people in a myriad of ways, ranging from school closures to the long-lasting social and economic effects of the pandemic. We face a mental health crisis, the loss of education, growing youth unemployment, increasing levels of violence and abuse, all exacerbated by the pandemic. And it is the most vulnerable youth who are impacted the worst. However, we have the opportunity to harness the power of youth to build back better. Let's start today in our discussions between young people and ministers. And let's use this platform working together to push for real action. Thank you.
Always a great pleasure to hear from you, young people doing amazing things. And like I said, we have a young activist who is on the virtual stage and she will join me shortly. Sarah Cognac from Costa Rica. You know, Sarah, you have heard your minister speak, and also Jayathma speaks about opportunities for change and improvement and the actions that we need to prioritize, including quality education and addressing the social determinants of well-being. Sarah, are there any other missing pieces to this puzzle?
Bueno, yo considero que en efecto, ¿verdad? Ya se tiene como identificado los distintos desafíos y aún más importante que las personas adolescentes son quienes han podido también en los distintos contextos decir cuáles son esos desafíos que están viviendo y poder relatar también sus vivencias y realidades. Y esto es bastante importante porque no se está haciendo desde una visión adultocéntrica de solamente suponer esos desafíos. Se ha aprendido a escucharles y todavía se sigue abogando por espacios donde puedan dar sus opiniones. Sin embargo, creo que nos sigue faltando un par de piezas en el rompecabezas. Desde mi experiencia, creo que una es que ocupamos que su voz pase más allá de solamente dar esa opinión, sino que sus opiniones se puedan integrar realmente en los procesos y que se puedan transformar en propuestas dentro de una agenda internacional, nacional o local. Esto lo vemos, por ejemplo, en el tema de acción climática con las contribuciones determinadas a nivel nacional, conocidas como NDC. En algunos países se habilita que participen adolescentes, pero no en todos se está logrando integrar estas opiniones en el producto de la NDC al final. Es decir, pocas veces las voces de los y las adolescentes logran ir más allá de ser solamente escuchadas. Para eso entonces ocupamos que en los países se asuma el compromiso de construir metodologías sensibles a las personas adolescentes, por lo que necesitamos este compromiso más allá del discurso de parte de las personas tomadoras de decisiones que por mandato permitan construir esas metodologías que vayan desde el proceso de consulta hasta el poder incluir a las personas adolescentes en la redacción y revisión de los distintos documentos o propuestas que se trabajen en cada uno de los países. Entonces considero que nos hace falta construir de manera integral este vínculo o puente para que las opiniones adolescentes pasen a ser parte de las propuestas. Cuando lo logremos, vamos a tener procesos realmente ambiciosos e inclusivos, sobre todo ahora que necesitamos de un desarrollo integral ante la situación por el COVID-19. A esto se suma entonces que ha faltado una visión para comprender que las y los adolescentes también son agentes de cambio y que están actuando ya, por lo que se deben visibilizar sus esfuerzos. La otra gran pieza que considero que hace falta es cómo se trabaja con las poblaciones o grupos más vulnerables, porque el COVID-19 y la crisis climática están dejando al descubierto las grandes desigualdades que aún tenemos como sociedad y que van a continuar aumentando. Ante esto, en Costa Rica, grupos de adolescentes y jóvenes hemos apostado por trabajar en la creación y fortalecimiento de capacidades como un camino para poder acercarnos a trabajar con estas desigualdades y poder reducirlas. Es un proceso que se debe acompañar con el acceso pleno a los derechos, el acceso a recursos y financiamiento para poder mejorar las condiciones y medios de vida y sobre todo tener una atención integral, recordando justamente que todas estas vulnerabilidades son multicausales. Entonces creo que cuando realmente podamos integrar a las y los adolescentes como parte de las propuestas y cuando podamos atender las desigualdades existentes, vamos a poder realmente hablar de cómo avanzamos hacia un desarrollo sostenible y una acción climática real, sobre todo en el contexto por el COVID-19.
Thank you very much, Sarah. And you raised really valid points. Adolescents not just being heard, but having their opinions and their ideas integrated into the designing and policy formulation and decision-making areas of dealing with their well-being. And now I'll ask Maziko, who will be the last speaker for this panel, to just put your camera on. And Maziko, you have been very passionate about adolescent well-being and about the Adolescent Wellbeing framework and its 5 domains. What are the implications of these domains in programming, just factoring what Sarah has talked about, including the voice of the adolescents into what we are designing policy-wise?
Thank you, Mercy. So as you may know that adolescent well-being is defined as adolescents thrive and are able to achieve their true potential. What the adolescent framework does is it unpacks its definition and it delineates 5 fundamental domains of adolescent well-being as good health and optimal nutrition, connectedness, positive values and contribution to society, safety and a supportive environment, learning competence, education, skills and employability, and agency and resilience. What is very important about this framework is how it humanizes adolescents and young people. It humanizes them as more than just statistics or the current largest generation in history or the missing population. The framework recognizes them as human beings, as individuals with unique needs and experiences that need interventions and programs that are tailored to the context of their communities. From the COVID-19 pandemic to humanitarian and fragile settings to hard-to-reach rural communities, the framework is bridging the long-existence gap that has marginalized and silenced adolescents for a very long time. The framework is also calling state actors and duty bearers to humanize adolescents, and the only way that we can really humanize adolescents is by harnessing these 5 domains synergetically in our programs and interventions. So the most important thing that we can do it's humanize adolescents and young people and view them as more than just a homogeneous group and a monolithic group. As Sarah had mentioned, we have our own diversity, our own uniqueness. And the only way, again, I repeat, that you can humanize adolescents and young people is by really harnessing the 5 domains synergetically in our programs and interventions. Thank you.
Well, thank you very much, Maziko. And the whole panel that we've had for the beginning segment, Maziko's statement just marks the end of the first section, but we are moving into another section. And I just want to say thank you to everyone who's participating on chat. We are seeing you people who are talking about mental health and how important it is when you talk about adolescent well-being. Juan Jared, thank you very much for your comments. Please keep the conversation going on chat. And now we are going to move into our next session where we're going to talk about, adolescents and what they need to see the ministers in their countries and globally do when it comes to their well-being. And in our quest to build back better, it is very important that we take these conversations to the national country level. These forums and discussions are only a start. We need to see actions and policies that are country and country-driven. We need these conversations, the needs by adolescents to be brought up and given attention in the upcoming high-level political forum discussions as participants explore various ways of the response to the COVID-19 pandemic. So I'm really excited about the next session going into the breakouts. There will be 5 rooms and you can only join one of them. So please do join the region of your choice. If you go at the bottom of your screen, there is 3 dots written more, and then there's where you can click on breakouts. Please do click on breakouts and choose which room you want to go to, depending on the region. But Latin America and Caribbean, please stay in this room. And I hope you enjoy the discussions. 40 minutes, I'll see you back here at the top of the hour. I think we all have to agree that we have a lot of content, a lot of really live and interacting discussions that we can go on and on about. But unfortunately, we do not have the luxury of time. And as always, we should take these discussions away from this virtual event, away from this forum. So, ladies and gentlemen, social media, your social circles, your boardrooms, even your houses, your families, please be champions for adolescent health and well-being. And I can see most of you are back. So welcome back, everyone. And I am sure you had such insightful regional discussions reflecting on policies and programs. And very quickly, because we are running behind time, very quickly, I will ask the facilitators to just highlight the top 3 challenges and priority actions from the regional group dialogues. Very, very briefly, please do not explain and give paragraphs, just pointers of what the top 3 challenges are in priority actions from the discussions that you had. And I will start with you, Desmond G. You're facilitating Africa, yeah?
Yes, thank you, Mercy. We had a very exhilarating discussion in Africa, and challenges abound, like trauma and loneliness, mental health amidst COVID, shrinking job market, very dire, education access and quality, and very, very clearly, access to health services, particularly holistic or comprehensive sexuality education, is in dire need. Now, the priority actions will be meaningful multi-generational action plan, investment to get young people adequate access to comprehensive sexuality education, as well as safety for adolescents who are in war-torn zones and the rest.
Great. Great, thank you, Desmond. That was very brief and to the point. And next, David Henry, you're leading the Americas and the Caribbean group.
Yes, so few pointers that came out, access to education, which has suffered because of a lack of access to the internet. Mental health, important to impact the great stigma associated with it. Violence and abuse at home. From the participation, we had industrialization, participation mechanisms where adolescents and producing change, producing change. We have some good examples of intersectoral collaboration, for example, in Costa Rica, telephone line during the pandemic. We have prevention of adolescent pregnancy, pre-COVID was intersexual. We have recommendations. Young people are leaders. We are exercising leadership already. We have all crises are interconnected. Climate change, health, nutrition, and responses should be interconnected and intersectional, should be inclusive and intergenerational.
Thank you, David. And next we go to Asia and the Pacific. Amit, are you online? Hi.
Hi.
Yeah, hi.
Thank you so much. Similar to like other region as well, we had like the limited access to education, school dropouts, and the limited education opportunities. And also like there were other social, economic, and political challenges also like concerning adolescent health and well-being, and mental health was also like one of the important challenges. We also discussed about the importance of comprehensive sexuality education and the importance of intersectoral collaboration and coordination for adolescent well-being. And also, we also discussed putting adolescent and youth at the center. Thank you.
Thank you, Amit. And next, Eastern Mediterranean, Sarah. So what were your top 3 challenges and priority actions from the dialogue?
Thank you, Mercy. We have discussed child marriage and how this issue can affect adolescents to give their full potential. And also we have discussed the technology gap and how this should be a human right for adolescents and how some of the adolescents are not being able to use the internet. Our top priority actions is young people need to be integrated into all discussions from the get-go, and they should be able to be affecting government's programs and to be a co-creators. We also have highlighted the importance of mental health and the need for greater resources and increase in funding regarding mental health support. And we have discussed that young people are capable of creating the change and taking actions.
Great, thank you very much. And lastly, the last group is Europe. Egle.
Thank you so much. So just very briefly, the pandemic is a test of solidarity and accountability for each one of us, and we have to strengthen our communities. Young people have to be a part of all processes and actively provide input, as was demonstrated through some youth councils that are being set up in some of the European countries. A dialogue between young people and institutions has to continue. Also, tokenism is harmful and youth are so different, so it's important that in these institutions and councils, all youth are included. Secondly, mental health is not currently prioritized enough, and there is a need for concrete plans on tackling mental health problems, especially in schools. And last but not least, there is a perceived digital health literacy gap. We have noted that there is an imminent need to address the opportunities offered by innovation and technology in context of adolescent health. Thank you so much.
Wow, great. Thank you so much to the 5 of you. I mean, you've been very resourceful, very great discussions. And it's amazing how all these things cut across the regions, from limited access to education, limited access to sexual and reproductive health services, mental health, child marriage, technology gaps, tokenism. I mean, I hope all the donors that we have here, the government representatives, you know, the policymakers, that we just keep in mind these things that the adolescents are really want to be addressed for themselves if we really want to build back better. And ladies and gentlemen, that marks the end of, you know, the breakout sessions. And I hope you at least got away with something meaningful and encouraging from those sessions. And now, before we go to the next session, I have, you know, a question for all of you in the audience. Please give me your answers to this on chat. You know, in your opinion and moving forward, in 2 words, just give me 2 words on chat. What do you think are key opportunities we can take forward to accelerate progress on adolescent well-being? What do you think are key opportunities we can take forward to accelerate progress on adolescent well-being? Please go on chat. Let me know your answers. What I've asked is just portrayed, projected on the screen. So let me know what your answers are. I can already see some people, yeah. Right, listen to the youth, activate equity. Josiah, thank you very much. Somebody saying government's commitment, youth leadership, that is Amit. And then promote the story. Renu, Manpreet, we must not forget the biggest killer of young people, road traffic crashes. Somebody talking about collaboration. So thank you very much. Keep the responses coming. And I'm so excited that this session has been this interactive. Youth at the table, very important. Quality education, social media, accessing contraceptives to adolescents. Youths matter. Anita, recognize adolescents' opportunity. Whoa, thank you so much, guys. I'll be able to just come back and read some of these responses later. Empowerment, remember youth with disabilities, nothing about us without us. Be friends with them, be friends with the youth. Thank you very much, people, for all the pointers that you're putting on the chat box. And please remember to also keep the conversations going on social media. Hashtag Adolescents 2030. Now we are going into our closing segment, and here we're going to have a group of people to just talk about, what next moving forward. And joining me on the virtual stage, we have Honorable Undersecretary Juan Antonio Perez, Executive Director, Perez III, Executive Director, Commission on Population and Development from the Philippines. And after him, we'll have Chewe Luo from Associate Director HIV/AIDS Health Unicef, and then we have Gil Mariano, Streets to School, also from the Philippines. And I will start with you, Honorable Antonio Perez III. And quick one, how can we accelerate progress on adolescent well-being, in particular during this pandemic? What are the immediate next steps that we need to see from world leaders? Or definitely based on all the discussion that you're having about adolescent well-being. What are the next steps?
Thank you, Mercy. Magandang umaga from the Philippines, as we say. It's good morning. In this event, we have seen a dialogue of young people and ministers, government leaders, on how their needs and concerns are being addressed at this time of a pandemic. This ensures that young people's well-being are among the priorities of every nation's concerns. As one of the countries in a community quarantine, the Philippines has seen that COVID-19 is greatly impeding young people's sexual and reproductive health. This leads to women in the country having a 42% increase in unintended pregnancy and a 67% increase in unmet need for family planning and reproductive health services. And that will include at least one adolescent among every 10 of those women who need support in terms of family planning and reproductive health. Structural issues that have arisen during the pandemic have led to young people being confined to their homes, facing logistical hurdles in accessing care, and when pregnant, are affected with severe service reductions due to quarantines and lack of mobility. Containment and physical distancing measures may limit the capacity of youth to exercise their rights. It may lead to discrimination and exclusion of young people from decision-making processes at every level. At this point, the Philippines calls on world leaders to ensure that young people have, first and foremost, access to sexual and reproductive health information and services so that they can fulfill their rights in platforms that are available to them. And very often those platforms can be helplines, can be in social media, and those platforms must be safe and trustful. Young people need to have access to safe, trusted, and reliable information, which are integrated to services. So they should not stand alone as just providing information. So that we can ensure that health services, protection, and psychosocial support and gender-based violence care are available for those who need them the most. With a spotlight on adolescents who are most vulnerable to the risk of COVID-19 as our main focus, in my country, and I guess in this event as well, We join the call for a societal approach where adolescents who are considered vulnerable and most at risk are top of mind of those who can help them. These are adolescents who have no decision-making power, who have no economic independence, considered by many countries as powerless and with no autonomy. They will include adolescents who are pregnant, with greater risk for repeat pregnancy if they are already mothers themselves, and vulnerable to gender-based violence and intergenerational poverty. As a measure to accelerate efforts to address vulnerability among adolescents in the Philippines, today we are designing a social protection program for adolescents who are already parents in the middle of a surging pandemic. And we in government are in dialogue with the adolescent parents to ensure we meet their needs comprehensively. I call on countries to provide multidimensional sources of protection for these vulnerable adolescents, meaning access to safety nets, social insurance, social assistance, and the labor market. These have been echoed in many of the regional breakout sessions. Protecting adolescents and giving them the means that will be their best start for adulthood is our mission as duty bearers. Let us sustain partnerships with young people on initiatives that leverage young people's efforts in adolescent and sexual reproductive health in particular. We believe that a strong and sustainable recovery is possible only if young people are reached and included in this process. I end by asking countries to ensure that young people should have meaningful participation and safe spaces in the time of these challenges. Maraming salamat po. Thank you and mabuhay.
Great. Thank you very much, Honorable Undersecretary Juan Antonio Perez III. And now you raise very valid points. Chewelo, please put your video on. Let me see you. You are the Associate Director, HIV/AIDS Health, Unicef. Now, the Undersecretary mentions really, heavy points when he talks about, the number of priorities that we need to focus on as a global community and provision of multidimensional levels of protection and what countries should do at a national level. And we know that policy and programs are country specific. More than ever, we all agree we need to work together to ensure the well-being of this group of people. But what do you see as the top 3 priority areas, and how is UNICEF and other partners or how can UNICEF and other partners come in to help deliver on these priorities, especially at a national or country level?
Thank you, Mercy, and thank you. I mean, this has been a wonderful conversation, and I'm very happy that I had the opportunity to participate. I'm Dr. Chewelo. Can you hear me?
Yes, go on, we can hear you.
Yes, I'm Dr. Chewelo. I actually lead the HIV program at UNICEF headquarters in New York. And I think as I've been listening, I've picked up 3 things that I want to share with you. One is that we have to be true to ourselves and make sure that programs and policies for adolescents are adolescent-centered. And how do we effectively do that? It's really by engaging them, asking them what type of programs and policies are relevant to them. Applying best practices and evidence-based methods means asking adolescents what are their needs and what are the best ways for us to fulfill them. They're accessing our services, they're accessing our schools, but they're coming back and saying things have to change. And I think from this dialogue, it's very, very clear. I just want to say that from UNICEF's standpoint, we are committed to engaging adolescents through our program planning, implementation, and evaluation. And I just want to mention that through the guidelines that we have developed, engaged and heard guidelines for adolescent participation and civic engagement, we are helping partners, including governments and private sector, to do the same. The second point that I want to make is around adolescent responsive health systems that should be prioritized and financed. We have been on a long journey talking about adolescent-friendly services. But what I want to mention, as we've been trying to do that, is that we recognize as a community, global community, that legally, adolescents are children, but developmentally, they are between children and adults. Adolescents require health systems that recognize this. How do we deliver services to them that are appropriate for them, knowing that they're going through this development cycle? Adolescents require preventive as well as promotive services for issues such as lifestyle risks, mental health, as we've heard here, sexual and reproductive health, including HIV. Since adolescents do not tend to go to health centers, these services need to come to them. This will require the health system to think out of the box. Information and services need to be provided in schools, communities, as well as online. And we've learned through this COVID response that having platforms that reach out to adolescents, regardless of whether they're able to come to services within clinics, are critically important in sustaining the responses that we have. Unicef is developing learning materials such as comic strips, study guides that can be used in schools to tackle taboo topics such as mental health and well-being among adolescents. We are also contributing to global guidance on comprehensive, we have contributed to guidance on comprehensive sexuality education in and out of school. The third thing that I want to mention is about the multisectoralism of our response. It goes beyond the health sector, and we need other sectors to respond, such as schools, social protection, water and sanitation, justice, housing, safe environments, digital solutions, friends and adults. And multisectoral ministries and sectors need to work together systematically to provide a more cohesive policy and programming environment. And I think for me, the final thing I want to say, we can talk about the multisectoral response, but without clarity on how we coordinate that and how we manage that. And in many countries, the coordination is not that strong. And the sector ministries are doing stuff, but we're not bringing everything together. And I think more importantly, we're not even looking at the data together. And so coordinating around management, coordinating around data is going to be critical if we're going to shape and refine and reimagine a world where we have adolescent-centered programs. Thank you very much.
Great. Thank you very much, Chewe. Thank you very much for those really amazing points. And now, ladies and gentlemen, we are coming to the end of this session. But before we wrap this up, let's listen to this young man, Kiel. I hope I got the pronunciation of that name correctly. Kiel Mariano, you have been an excellent champion for education and quality education from through streets to school in the Philippines. Now, what is your reflection? And if you had to make one appeal to the change makers and leaders across the world and people who have the capacity to make decisions, some of them who are in this forum, what would your ask be and why?
Hello, everyone. I am Kiel Mariano. I am the founder and executive director of Streets to Schools, an organization I founded with friends when we were only 12 to 15 years old. The past few days in the Philippines has not been so good. We have around 7,000 to 15,000 COVID-19 cases daily. And just today, we recorded more than 382 deaths, the highest since the pandemic started. Just last night, I read a post on social media on how a certain hospital told the family that a bed is available for their COVID-19 afflicted mother, 3 days after she passed away. Hospitals are overwhelmed, Nurses and other healthcare workers are overwhelmed, and even people like us are overwhelmed at our home. Every single day, it hurts. And in these times where the world would forgive us for doing nothing, because make no mistake, staying in home, wearing masks, practicing social distancing, this may seem small, but they are all essential to beating this global health crisis. We could have chosen to sit this one out and wait for the storm to end. But young people like you and me are taking the lead. We are organizing fundraisers to raise millions of dollars to feed jeepney drivers who lost their jobs because of the pandemic, or to provide relief to the frontliners who are just as fearful as we are. We are helping create policies, engaging in dialogues to campaign and advocate for the well-being of adolescents and children. We are realizing that behind this global health crisis is a children's rights crisis, where children have limited time to play and have an education. Just because of this pandemic, the cases of online sexual abuse and exploitation of children is rampant. In just 2 months of lockdown, cases rose to 265% in the Philippines, or over 279,000 reports of online abuse towards our children. If the home is not a safe space, then what place would be? Young people are aware, and they have the capacity to do something about our world's problems, which is why I echo the words of Carlos P. Romulo, one of the Philippines' greatest diplomats, that there should be no inferiors and no superiors for true world friendship. And I modify this great statement by saying, no one is too young and no one is too old to make a difference. Gone were the days where adults would tell us we are too young to make a difference, because our goal as young people is to participate. Because if we are inexperienced, then adults should give us experience. They should allow us to participate and become part of the implementation process, simply because this is also the future that we are fighting for. We have the responsibility to become empathetic to the world's problems. We have tough shoes to fill in, and we are willing to fill in your shoes. We are willing to take up the mantle, simply because our future is at stake, and for the future that rightfully belongs to our children. And we can only do our job if you allow us to do our job. We have the invaluable right to participate, and as a child or a teenager who knows the full extent of their rights, this is what I call adolescent well-being. And with this well-being, we can proactively address our 2030 agenda, because it's not too late. We can still make a difference. I want to end this with a message of hope, that in this life full of struggles, we have to choose our difficulties wisely. All of you from different walks of life are passionate about this shared topic on campaigning for adolescent well-being. And I tell you, this is no easy task. Designing posters, campaigning for this advocacy, and creating these policies, forming partnerships, and doing extensive research, none of these are easy jobs. These are all difficult. But it is also difficult to see children and youth suffer from preventable diseases, abuse, and the violation of their rights. This is a group composed of passionate people who chose to struggle and champion adolescent well-being. And we call this our shared advocacy. And we want to do this because we want a future where no one will be left behind.
Wow, great. Thank you very much, Clay. And what a powerful way to just end the speaker list for this session. You know, and before we wrap this up, I have a poll question for all of you. Kiel talks about young people and having a safe space for them. We are asking you, and the poll is on the screen, who or what did young people consider as the single most influencing factor in their lives? I can see the responses coming in. Who or what did young people consider as the single most influencing factor in their lives, whether it's good or bad? Thank you for the responses. Yeah, about 30-something% of you say the internet, 25% say their friends, 2% say their teachers, and 30% say their parents. I'm going to end this poll in about 30 seconds. So please, let's see your votes. Let's see your votes. As of now, 42% say the internet, 26% they are friends, 3% they are teachers, and 31% they are parents. Okay, let's end this poll now. Do you know what the answer is? 89% of young people globally say their parents influence their values a little or a lot. Their parents influence their values a little or a lot. Now, Kiel said something. If the home is not a safe place, then what will be? If the home is not a safe place, then what will be? Well, that's a question we need to go and ponder about. I will not take any other poll question, but I want us to go to the closing segment of this virtual event. Ladies and gentlemen, I am a journalist by practice, journalism by profession, and I have seen firsthand the ravages of COVID-19 on adolescents' health and well-being. And sadly, these are some challenges that we're witnessing even before COVID-19. And we are going to witness them in years and years to come unless we do act. We have young people, 10, 11, 12 years old, who are getting impregnated by their relatives, by people around them. They're turning to become young mothers, people suffering from mental, health issues, young people. 1.2 billion people in the world today between the ages of 10 and 19. If we do not address these issues, then what kind of adults are we going to see in the next 10, 20 years? Are these adults that are going to be able to cope up with everything that will be placed at the table for them? If we do not act now, then we're going to see a repercussion of things that we could prevent if we choose to holistically address issues around adolescent health and well-being. Now, this marks the end of this session, Uniting for Adolescents During COVID-19 and Beyond, graciously co-hosted by the governments of Philippines and Costa Rica and co-organized by many other partners. So thank you to every one of you, the youth, ministers, youth activists, government representatives, donors, NGOs, civil society educators who chose to spend the last 2 hours with us. But this is not the end. Let's make this event a start of more meaningful and deliberate conversations that will turn into policies and action plans and laws. We need to champion for the health and well-being of adolescents. I am so excited to see all the commitments and partnerships that will come out of these discussions. And most importantly, for the government representatives here, the adolescents are banking on you. Let us champion for their rights and let us rally behind, the messages in the call to action for adolescent well-being and the BMJ article, even as we charge up for the global summit on adolescent health and adolescent well-being that will be held in 2023. So once again, thank you so much for choosing to spend the last 2 hours with you. And let's see these conversations going on social media, in your boardrooms, like I said, and in your homes. Please champion for the health of the 1.2 billion young people who in the next 10, 20 years will be the adults leading these nations that we're talking about. Thank you and all the best. My name is Mercy Juma from Nairobi, Kenya, and it is a great pleasure to see all of you virtually. Bye-bye.